own. Let's talk to Shelley Poerio from Living Free Health. Shelley, you're, of course, a therapist, but also a drug treatment counselor. Mm-hmm. Have you been seeing a spike in people, either drugs or alcohol, or even just struggling when they're in treatment? How's that going?
I think we're seeing people, to some degree, struggle in treatment. I think that people have concerns about coming into treatment and going to their regular sessions because they have family or elderly in their homes where they're concerned about maybe bringing the virus in. In some cases, honestly, I think we have people who were kind of on the fence about recovery, and so this is maybe an excuse for them to delay their treatment or to put things off. And then for others, we have some that are embracing it fully, and in fact trying to stay very well connected because they do realize that isolation is definitely a problem for recovering alcoholics and addicts.
And then as far as your treatment right now, you are still having group sessions. Can you talk about that?
We are having group and we are having individual sessions. We're also hosting 12-step meetings, and we're using the COVID compliant or CDC compliant rules as far as we're using bleach spray to wipe everything down, to wipe in and wipe out, if you will. We have extra staff and volunteers who are going through cleaning. As far as the 12-step meetings are concerned, each meeting has a person assigned for hygiene, a hygiene manager, if you will. So we're trying to manage that and make people feel as safe as possible. In addition, in our office space, we have the seating has obviously been reduced in our group rooms, and we have used masking tape basically to identify where people should sit and where they should not sit. So it makes it easier for people to not get too close, and I think just to have a little bit more of a sense of confidence in the fact that they're there getting the treatment that they need, and help to reduce some of the worries that they might have about getting sick.
And so are you taking any of those phone calls where people are they're struggling right now, or are they just coming into the group sessions? Is there a kind of an emergency phone line for that?
We don't have an emergency line per se. I mean, my cell phone number is out there in public, and people can call me anytime, and sometimes they do call, at 8 o'clock on a Friday night. The interesting thing I would say in the first couple weeks, what we saw was that people were very engaged, and in fact, maybe more people were trying to figure out what to do as far as treatment and staying connected. And as time has kind of marched on here with this, and like a couple of the other panelists have talked about, and you've talked about the uncertainty factor, it seems like people are maybe not as engaged, and some are and some aren't, but we're seeing some of our clients kind of fall off the radar. We've had several, though, that have completed and graduated. One of the things that I think is important is that there's been a lot of talk about telehealth and how great telehealth is, and it is a good thing, and it's especially a good thing to be able to reach into the rural areas. Having said that, however, what we found is that a lot of the folks that we really need to be able to reach don't have the resource. They don't have a strong internet connection. The phone that they do have is not entirely capable of holding connections. And we've tried 3 different platforms for telehealth that are telehealth compliant. And we've even had people bring their phone in and let us try to do it ourselves in case they were making some kind of an error. So when you see some of the most vulnerable people out there lacking that resource, and then we have difficulty even reaching them by telehealth, I think that's pause for concern.
And that's something